My role at St. Luke's is the Senior Vice President and Chief Digital Officer. So I have responsibility for all of our technology and also co-lead our Innovation Center within the organization. So a lot of the initiatives around change fall under my purview. I see virtual care as a technology that can help address many of the workforce challenges. Specifically, I think the staffing shortages really require us to be able to, take care of more patients than what we historically have been able to do. And virtual care and all of those capabilities help us create new types of jobs in the care setting. The virtual nurse is a key example of that. They're providing support, whether it's monitoring patients, helping to do discharges, or completing the admission process virtually, pulls that workload off the bedside nurse and frees that bedside nurse up to do more oversight of the patient. So they're more efficient. They can take on more patients because they're getting support. Virtual care can enhance the experience the patient has. So our patient satisfaction survey results show that in those care settings where we have a virtual nurse, there is a better perception of the care from the patient. And particularly in the communication and the care coordination, it is my CEO's opinion that the home should be the epicenter of care. And that vision and that philosophy means I have to have the ability to bring the technology into the home and make that work really effectively. From the clinical perspective, it was challenging to get buy-in from everyone on this care model. We piloted it in a unit and really tested it out and streamlined some of the tasks that we did in that care model. And we had to spend a lot of time talking with various care team members about it and show them the evidence about what the experience was and the time savings and the efficiency gains and how this was going to help them and be a win for them. We did that first, and then once we had that pilot completed, we expanded it to an additional 4 units at each of our metro hospitals. Once we completed that process and felt like we really had a very effective process, we said, we're going to go all in and we're going to put it everywhere. And I have to tell you that at the end of this year, we had, I believe, about 200 beds set up with this virtual care model. And prior to the Christmas holiday, we did more discharges in that day than we've ever done in our entire history. And it was because we had those efficiencies associated with that virtual care model. It was a tremendous proof that this was an effective tool for us. I'm really thrilled that St. Luke's made the investments that they did in the technology because it's been such an enabler for us to do the transformation that we need to do.